Remember when you used to tell everyone that you had better than 20/20 vision and that you could see so good at night? And you remember that one friend that you had that had those Coke bottle lenses, those thick lenses in those glasses? Look at you now. You're having problems seeing things up close, like looking at a menu, reading your text messages, seeing price tags at the grocery store. And now, nighttime, it's blurry for you too. You're one of us now. And I know, you might be wondering, do I need reading glasses? Is this just me aging? Is there something wrong with my eyes? In this video, I'm going to explain the difference between hyperopia, also known as farsightedness, and presbyopia, which just usually kicks in as we get older. And by the end, you'll understand exactly what's going on with your vision and what you can do about it. Let's get started. All right, let's start with hyperopia, aka farsightedness. Now, I know the term farsighted can be a little confusing, but honestly, it's exactly what you're saying. So if you say that you're farsighted, that just means that you can see things that are far away. So things up close can be kind of hard to see, especially if you're hyperopic, but that's not always true. In fact, as you get older, even your distance vision can start to feel a little off, especially when you're driving at night. And here's what's happening behind the scenes. With hyperopia, your eyes are often too short from front to back, meaning the length of the eye is a little shorter than normal. This may only be a millimeter or two off, but that small difference can cause light to focus behind the retina instead of directly on it. This doesn't mean that your eye looks small, it's just that the internal structures affect how you focus. When you're young, your eyes are so flexible and strong, so you can compensate without even noticing. The best way to describe this is when you're young, your eyes typically just auto-correct your vision, and it makes things come into focus on its own. But over time, especially after 35 to 40, your focus system loses power, and you can no longer auto-correct your vision like you used to. You might start to notice things like blurry near vision, eye strain after a long period of time of being on a screen, and sometimes even blurry distance vision, especially in low light, like when you're driving at night. Also at night, your pupils dilate in the dark. So that means you lose depth of focus. That's when uncorrected hyperopia becomes even more noticeable. Glasses or contacts can help refocus light onto the retina, which is the back of your eye, and then help relax your eyes so you can just focus better and easier without having to struggle. All right, now let's talk about presbyopia, which eventually affects almost everyone. Some sooner than others, but eventually it will happen to you. So if you live long enough, it will happen to you. Presbyopia starts in your early to mid 40s. It's caused by something different. The natural lens inside of your eye becomes less flexible over time. Think of this lens like a built-in zoom in function. When you're young, it flexes easily, allowing you to switch from far to near focus in an instant. But as you age, that lens stiffens and that zoom function slows down. And eventually it just stops working altogether when you look at things up close. You may notice that you're holding your phone farther away, needing brighter light to be able to read and squinting to bring small text into focus. Here's something most people don't realize. Presbyopia is the first visible sign that your lens in your eye is aging. And as the lens continues to stiffen over time, it also starts to cloud, and that clouding is what we call a cataract. So in a way, presbyopia is step 1, cataracts is step 2. So if you live long enough, you will develop cataracts at some point in your life. Most people develop cataracts at the age of 60 to 80, and then those of course lead to foggy vision, glare at night, colors looking faded, and eventually blurred vision even with your glasses on. The good news, cataract surgery is safe, common, and is often improves both distance and near vision with the right lens implant. All right, now I know you're confused. You're like, what is the difference between hyperopia and presbyopia? So I'm gonna break it down for you really quick, okay? So hyperopia is just a refractive error, meaning it is usually caused by the length of a shorter eye or a weakening focus power. It can affect both near and distance. Presbyopia is age-related loss of a lens flexibility. So it typically affects your near vision, even if you've never needed glasses before. And yes, you can have both at the same time. Some people are born with a mild hyperopia with their eyes, and their eyes are fine, usually in their 20s and 30s, but once presbyopia kicks in, they can lose that flexibility, and then all of a sudden, their near and distance vision just seems to suffer. So nighttime starts to feel like it happened overnight where their vision is blurry, and looking at things up close also feels like it just happened overnight and their vision is blurry. But that's why your eye doctor checks for both during a comprehensive eye exam, and they can give you the best options for what is best for you. All right, so you want to know how to fix this. And so for hyperopia, it's pretty simple. We prescribe lenses that help move the focal point forward, usually with plus lenses. This is so that the light can land on the retina correctly. And for presbyopia, there are several options, a lot that you've seen other people use, like reading glasses, progressive lenses, multifocal contacts, monovision correction, or even surgical options like laser or lens implants. And for those who eventually develop cataracts, lens replacement surgery not only clears the cloudy lens, but it can correct both distance and near vision at the same time, depending on which implant you decide to get at that time. So overall, if you were in your 30s or in your 40s and you start to notice these changes in your near and distance vision, you are not imagining it. And I'm gonna be honest, after the age of around 20, our focus system kind of goes down a cliff. And this is why some people, even in their early 20s, start to notice they're having vision difficulties compared to like when they're in high school. But overall, hyperopia, presbyopia, and early lens changes can all make daily life a little harder, but the good news is it's all treatable. It's 2025, just Google it or ask AI, don't be silly. If this video helped you understand what's happening to your eyes and you learned something new, consider subscribing, hit the like button. I'll see you in the next one. And don't forget, go touch grass.